this is the first time we realize that how our neighborhoods are really not catering to what we need. What is it that is existing for young people, for these kids who are, let's say, who are not adults, but are in a transition phase, the adolescents. India is one of the youngest nations, right? And we have about approximately 20% of our urban population in this category of adolescents, which is 10 to 19-year age group. And this is a demographic dividend. The primary finding was about, access. They don't know whether certain types of public spaces are accessible to them or not. Right? They were not really aware that what kind of facilities public spaces can actually offer. A lot of areas which were low income or vulnerable areas where, with lower income communities, there they said that we don't even have access to public. The kind of stories that came out of that was fantastic. To an extent that they said that we don't take this route because we don't feel safe. Okay. So we go take a longer route and go back to our place. Things like that. They said, elders will come and sit and they'll not let us play. So when we can sit on the ground, elders can't do that. Correct. So don't give seating.
20% of India's population is young people or adolescents between the age of 10 and 19 or 21. Are the cities friendly for them? Do we even bother about how they experience the city? Or we just think that they should be in school and not anywhere else? This is something I spoke with Prerna Mehta, who's the Associate Program Director at WRI India, who's been running programs around the youth. Hi, I'm Sathya Sankaran. Welcome to the OoruLabs podcast. Let's listen to Prerna Mehta as to what they have been doing and what we think the future of a huge percentage of our population is going to be in our cities. Prerna, welcome to the show.
Thank you for having me.
Pawan sent me your number and said talk to her. She's doing something interesting. I was curious. What does young people really mean, and why does somebody in the policy space and in the planning policy and urban space want to look at young people? What is so interesting about them was something I was curious and I wanted to ask you. So why don't we start there? What excited you about young people? Why do you even want to spend time studying this as a topic for WRI's interest?
So let me start from the beginning, how it really started for us and for me as an individual. So, in 2020, when we were sort of really just recovering from the shock of COVID, that's where we started to sort of really get back to reality, started to connect with people a little more, and we started to speak to, our own circles. And the most common point of conversation was, what have they been through during this COVID time? That was the first conversation. After you ask them whether you're all right, and everybody says that, yes, we're all right. And then that was the next question, what happened? Is everything all right? How did you cope with it, etc.? And what I realized, and what we as a professional group also realized, that, people were basically talking about, how they felt very confined within their own, spaces. They were at home, people were at home, they were comfortable at home, but they were still confined. It was like, you just can't move out. Even, stepping out in their own, people staying in their flats, stepping out in balconies were also questionable. They were like, should we go out or not? Right. So that's where, this whole conversation of public commons and public spaces and public realms started to happen. And the more we started to speak to people, we realized that this was really a very common thread across the board. And it was not limited to any specific age group. Okay. You were speaking to senior citizens, you were speaking to to your parents, your peers, their children, and anybody in the ecosystem of your own circle. They were all talking about the same thing. And then some of the professionals were also talking about that, this is the first time we realized that how our neighborhoods are really not catering to what we need, and this was all in context of public realm, public commons, and those public spaces. So that's where this whole idea started to sort of, develop, evolve, within our thinking as a policymaker, as an urbanist. I was, constantly thinking about it. And one fine afternoon, I was, having a catch up with my executive director. And, we were speaking about this opportunity that there is an interest to look at, how we can make healthy cities for adolescents. Mm-hmm. And I was like, this is very interesting. And I have one idea. If we are able to sort of share it and see where it goes, where it evolves, then we have this can we have this conversation on public commons and adolescents? These are the young people that we're talking about. And when we started to speak about it as a professional, we realized that, and did a bit of research in this system, that what is it that is existing for young people, for these kids who are, let's say, who are not adults, but are in a transition phase, the adolescents.
What is that age group for our viewers? How do you define young people and adolescents?
So a common definition of young people is between 10 years to 24 years. But the age group that I'm talking about is largely between 10 years to 19 years, where we can easily sort of categorize them into early adolescence, mid adolescence, and late adolescence. And this is something that we started to look at, and what we realize is that actually India is one of the youngest nations, right? And we have about approximately 20% of our urban population, in this category of adolescents, which is 10 to 19 year age group, and this is a demographic dividend. And I'm not saying that we are not going to lose that demographic dividend. Eventually, they're going to grow up, they'll go into different age group. That's fine, but this is a demographic dividend that we have, and hence an opportunity, right? And in India, the government of India has launched several policies. They've launched missions, initiatives around youth, young people, but they are largely concentrated around nutrition, education, health. But the point of urban development and young people has not really been, looked at very, very in depth through all the dimensions of how we can sort of include them within this whole urban development, processes, ecosystem, if we say. And also what we realized is that their perspectives in general are never sort of really looked at. Whether their perspective of how cities or urban spaces are dealing with them, what they are offering to them, what is their perception about it, what is their extent of participation as a citizen of the city, is not something that we have really done. This is something we realized, looking at a bit of secondary research that we were trying to understand this. But then this actually evolved as a hypothesis for us, where we realized that, in today's time, we look at development of our cities through the lens of, let's say, barrier-free architecture at some point was a very big conversation, right? So build barrier-free environments. And those barrier-free environments are really looked at through the perspective of adults, the senior citizens, those who are able-bodied. But it is not really looked at through the lens of adolescents. Their physical needs, their let's say the difference between their physical build, etc., is all different, right? And at different age groups. So the point is that this aspect is never sort of looked at. And on the other hand, very recently, India started to look at this whole child-friendly cities as a very important deep dive, targeted sort of intervention. Toddlers and their caregivers are taken care of. But again, this whole adolescence group is completely missing. So what we realized that, okay, this is something missing in context of India, that's fine. But is this the case even globally? So we really checked across the board. We looked at the new urban agenda. It talks about, inclusive cities for, youth and young people and all of that. And we looked at the SDGs, especially the SDG 11, etc. And these are there, there are There are triggers, there are points where, it is there, but it's not a full-fledged specific targeted call out. It's not there very evidently said and written, in specific. We also try to check across the board whether there is more research. There is, so there is research, but it is very limited. Even in global context and in national context is even far limited. So the point was, eventually, for whatever secondary study that we were trying to look at and through the data that we were coming across, we realized that this is really something that is not there in specific. It is camouflage under youth in general terms, etc., but not really as a target. That became a unique proposition for our conversation.
I've heard of these toddlers and younger children being created into projects, because I hear this constant: if the city is friendly for an 80-year-old or an 80-year-old, it's a city worth living in. This is the standard Enrique Peñalosa quote. That is to try to accommodate the extremes. But most of it, like you said, the schemes and everything focus purely on education, because this is the time they are in school and college. And anything that comes up is about how can I enable you to be in school and college.
Exactly.
Their consumption of the city is different. Maybe if you go beyond 18, they'll turn adult, and then you have a franchise. Then the politicians might be interested in them as a vote bank to, kind of see what you have. But below that, typically you're under parental guidance, and parents will decide how they go, what they go, and all those things. And it's usually curtailed. The 10 to 19 discovery of the city, I don't even know how. I don't remember doing that much of discovery when I was, understanding the city, engaging with the city. None of that really happened. What were your findings in this group? How do they consume the city? What are their pain points? Because that's the time they're growing. They have a different set of needs from the city and how they consume it. What were your findings in that?
Thanks for this question. Honestly, this is really, where we also started. So when we sort of stepped into the cities that we were working in, we wanted to sort of reach out to this target group. But while we were trying to sort of find ways and channels to reach out to this target group of adolescents, we also realized that, like you rightly said, they are under parental guidance, and we can't sort of isolate their caregivers from that. So what we did is we spoke to both the groups. We said that we'll speak to children, we'll speak to adolescents, and we'll also speak to their caregivers. And what it took us was several set of stakeholder consultations. Like we invested approximately 6 to 8 months of stakeholder conversations, and we're continuing to do that. It's not stopping. So it's like a process for us, right? So with the hypothesis that we had, we said, let's go and test and understand whether this hypothesis is really standing its merit or not. So when we went to our 2 cities, we started with 2 cities, Jaipur and Bhubaneswar. And we said that, let's see, Bhubaneswar has a legacy of child-friendly cities. And Jaipur was, very new, completely new to this. So we said that, how do we reach out? Because as an institution, as a part of the organization that I work with, we don't interface directly with this target group of adolescents. So we needed a channel or a partner to really do this for us. So first step we did was we actually went in the city and we actually invited all the stakeholders who were working with adolescents or for adolescents, within the city, and who were there for a long time, like, more than 2, 3 decades, 4 decades of work they've put in for this particular age group in whatever sector, whether it was education, nutrition, livelihoods, anything that they were. And thankfully they all came. And when they came, we actually tabled this whole idea of, that we want to have this intersection of adolescent inclusion within the urban development ecosystem. And we explained what we wanted to do. And our entry point was public spaces. We wanted to improve public spaces within the cities and increase the supply of public spaces for developing them, but making sure that, while other things are anyway going to be taken care of, their adolescent perspective is also built into that. So then basically what we realized is that there were some people who were interested. and they became our channel to reach out to these adolescents, and we spoke to all the sets of people, their caregivers, adolescents, different age group of adolescents, and everybody had their way of thinking and looking at it. The primary finding was about, one, access. First thing that came is access, whether it is near to where they are, whatever, work, play, stay, home, etc., schools, etc., whether it is near to that, combined with the safety aspect. What is the safety if the child is going by themselves? What is the parental sort of concern that there is? What we also realize is that, we clearly came across the, I shouldn't say bias, but we clearly came across the distinction of, the ease of usage for a certain gender versus the other, right?
Okay.
So that those nuances also started to evolve. But what we also realize is that prima facie, if the caregivers are confident enough that their children will be safe and they can access those spaces, public areas, in a very safe manner, and while they're using that space, they are safe, nobody's going to sort of harm them, they are fine with them to go out, be there, have that social connect, social interaction. But there were several parameters that actually came out of this conversation. And those we started to list those parameters, right? And we started it as a general list of what we were hearing. But then we said that we need to put it into a system. Right. And we said that because as a professional, if we have to make value of those conversation and that qualitative data, then I have to put some system to that. So that's what we started to then focus on. While we were hearing a lot of stories from them, but we also started to see what are the methods we can bring in to one, also capacitate them, because a lot of times we also realize that exposure level is also less. They do use public spaces, but they probably don't know what are the typologies. They don't know whether certain types of public spaces are accessible to them or not. Right? They were not really aware that what kind of facilities public spaces can actually offer. So we realized that these were some very clear gaps of, they need to be informed, educated, their capacities need to be built. And this just didn't happen with adolescents or their caregivers. This was also the case with the partners we were sort of working. So we had to sort of first make the partners understand. Then we went with them to the communities and we made the community, the caregivers understand. We also made the community champions understand about like whether there are teachers in the community, doctors in the community, whether there were elected members of the community. We had to speak to all of them to be able to actually work at that ground. And we did all of that. What it resulted into is, a big list of things that they wanted, or it's like a wish list that they wanted to have within their public spaces. And a lot of areas which were low income or vulnerable areas where, with lower income communities, there they said that we don't even have access to public spaces. So, the whole ask was that, can we have some public space within our areas? So that's also something that came up.
That was something interesting I wanted to touch on, because when you talk to people, like the children of the elite are helicoptered around mostly, and they are in safe spaces. They go to their college, they go to school, and then they come back, and they're usually chaperoned by someone or the other. I think disproportionately it's the lower income segment who are exposed to the public spaces more. And then you brought about the gender also, right? And this is the age where they're going through a lot of growth spurts, and it's the time when they're evolving, and how they perceive. They might be more callous or and there are interactions between adults and children and how they see. It's quite a complex way of engaging with the city. But in general, if I have to access a metro station, if I have to access some of the kids I see, if they have to go to tuition, they are able to quickly go. They've been shown by their parents, and they're guided by their parents. Our kids are not as independent to get out and consume because the safety is not there. We tend to hide them a little longer as much as possible.
Yes.
We are all parents and we know how we do that.
Absolutely.
But whereas in other countries, 10 to 14 plus, they're already out and about exploring cities, not just here, but outside. And that's a smaller percentage in India. Is that because of the safety? Is that because of access? Why do you think that is?
The thing is, it is the need. It's not about safety or access, it's the need. See, when you speak to a lower income group, their issues are very different than, by any elite group or any other middle or higher income.
Correct.
But the point is, irrespective of that, they did say that. So there is an element. So this is also sort of largely those breadwinners of those households or communities, right? But, and I'm not saying that, adolescents who are like 18 plus are not pulled into it. They are. But the point, that's the reality, right? But the point is, as parents, when asked, they want those facilities for their children, irrespective of income. And their consumption is not very different with how we consume, right? In fact, they want it more. For us, like for a lead group, there are avenues, options, easy, you can put in money, etc. But this is a group who will not do that, right? So their options are what is provided within the city that is free of cost and they can access it.
Correct.
That kind of access is what they're looking at, right? And that is limited for them because if you look at our cities, especially also, our networks of, let's say, public commons, except for if I not include streets for the moment, let's say. Streets are also public spaces, right? But if we really see those parks, those niches where, kids can go play, be there and not be scared of the road ecosystem, those are not very, proportionately distributed. It's either concentrated or, in certain areas, they're not even existing. So the point is and then they use those streets, etc. as their public spaces. But then again, the safety comes into it, right? So there are nuances. It's not one size fit all kind of a situation. You have to take it one typology wise, also, making sure that, and also find solutions to situations where something is not there only. So how do you provide it? What is the venue? What is the possibility? Right? So that was the kind of conversations that were coming up. And we said that, one thing that was very clear, that they knew their own neighborhoods very well. So we said that, okay, you come, and first we started to understand. Like, I'll give you one example. When we were speaking to adolescents and their, caregivers, we said, you tell us about a typical day of your child. We don't want details, but you say that, the child is going to school, they're going to a mandir, they're going to that historical place, they're going to a shop. Just tell us how a general typical day pans out. And then we asked those children to really map it for their own, neighborhood. We didn't give them any neighborhood per se. We gave them a plain paper. We said, mark your day. And the kind of stories that came out of that was fantastic. To an extent that they said, we don't take this route because we don't feel safe, So we go take a longer route and go back to our place. Things like that. We also said that, okay, the kind of exposure we tried to bring for them was, when we were doing workshops with them, we said, let's have a hands-on experience for them. So the spaces where we were doing workshop, we said that we'll figure out 2-3 typologies of public spaces and we'll take them to those places. And one of the incidences I want to quote here is, we were working with this small group of 4 or 5 kids, like, all between, let's say, 14 years to, 16, 17 years kind of age bracket. And we took them to these places, and it was a road. It was a patch of a road, which has a nice shoulder, very broad shoulder where vendors could do their vending and all. One of the chai walas were also there. So we said, Acha, but what you tell us? What is it that you want? What do you see here? What is your observation? So they started good, bad. This is not nice. This is nice, etc. And then 2-3 kids started to discuss something amongst themselves. We were curious, what are they discussing? So we asked them, what are you discussing? Share. So they were like, this is a very nice place. This was the shoulder of the road. The kacha part of the road. And they said that, convert this into a play space for us. Don't give seating. When you were like, don't give seating, why? So, and they said, elders will come and sit and they'll not let us play. So when we can sit on the ground, elders can't do that.
Correct.
So don't give seating. So the kind of inputs you get from these adolescents are they are very clear. This is what they want, right? How do you actually bring that clarity to inform your urban development is what we are talking about. And this became these kind of experiences became our base for creating that for really jump starting this work of how do we really structure this entire conversation to something very meaningful.
So when you get into the meaning part, there is one question of ultimately if you have to respond to these requests and other things. One is the way you are having to do the engagement, and is the government of the day at any level capable of these levels of nuance and engagement? Because usually it ends up that these kids are all adapting to the city. It's being built for someone else and they are adapting to it. It's not built for them alone, right? So
Correct.
It has to, there are things that the city weighs in. Even if there's a waste space, they don't think of utilizing it for some purpose. How do you think the authorities and the administrators can actually build capacity to respond to these kind of things? Do you think they are even capable of doing that, or what kind of a journey will that be in order to respond? Do they have the mechanisms to do what you did?
This is very critical for this conversation. And so the thing is, when we started to work within these cities, we also reached out to public sector. And when we showed them this intent, they were positive about the intent. They said that this is great, but you tell us how do we do this? Okay. So there was an acceptance to understand this. That's the starting point, okay. which is positive in itself. The modalities came later. So what we said that we are already doing this conversation. So they said you come back with what is coming out of these conversations. Mm-hmm. Like you asked me before, right? That what came out of this. And like I was talking about, how do we structure it? And when we started to collect that data, we actually ended up developing it into an audit framework. Right? And this audit framework in all respects is a co-created framework because it is from the ground reality to what you can actually do within, how you can actually look at certain public spaces. This helped us to advance our conversation with the public sector entities. And they are completely receptive of it, right? Because they understood that there could be a structure to this. And now the next modality is to see how you can sustain this kind of work. Right? How you can sustain and make it sort of, regular, when it comes to this collection of data, the generation of this data. So one is a tool like audit framework is helping, right? So with our current work, we are trying to, audit certain public spaces, create that data, show it to authorities and see that this is something that can be done. Short-term, mid-term, long-term kind of improvements can be brought in. And authorities are sort of really, positive about including that. The only thing right now we are sort of brainstorming is how do we make adolescents contribute on a regular basis. Like right now there is project that is existing. It has a timeline. Once the timeline is gone, how do we sustain it? And one of the very important ideas that are coming up, and we can take that little later because that's another interesting piece of conversation. But to answer that whether they are capable, yes, authorities are. They are receptive about it. They need help from professionals like us to help them structure this, which we are already doing. And they are doing whatever they can to include it within the current mandates that they have. See, so anything that has to latch into what the current governance system is, it has to sort of still align with it. So we are trying to give them a way of doing that. We are working with them to see if this can be integrated as a long-term sort of kind of work within the city development.
So when you look at that city development itself, there is a planning way of looking at it along with master plans and things like that. That doesn't have so much nuance. It even just getting the master plan from the water, waste, all that itself has become a big challenge, transport and everything. And here we are talking about people and the segregation from socio-economic side, from the gender lens, and from the age group demographic lens. There are so many of these nuances that an existing city needs to adapt to, and then they start prioritizing, saying, "Acha, this is the big infrastructure that we put in place. The road as a public place has its own contestations, and public spaces are being gobbled up based on the market demand, and more buildings have more and more monetary value. There is no value attached to the experiences that the people are facing, and they're continually adopting. It's interesting that the first step of putting a framework, audit framework in place is useful, because they can at least check and say, this is why we did it. At least that is there. How do you think you will handle the thing you said later? Why don't we jump into it? Is that how can this be rolled out? Let's say you finish and then move on. Who owns this audit, and at what times will they be able to do? How does the community, are there representatives of this community that will come over? Are they already existing? Do they need to be created? In most places, you won't even have that. It's hard enough to find communities to look at macro things, and this is such a nuanced thing. Where do you think this can be institutionalized? How do you see it?
There are 2-3 things that we are doing to sort of help this institutionalization, and it still has to reach a maturity. So with that caveat, I would say that, first thing that we did when we were working with adolescents is to make to train some champions, to sort of, train these adolescents and so that they can become some change agents and champions of this particular subject. To sort of give it a little more nuance, what we did is, as part of this structure, because this work that we're doing is with some of the local partners, so we call it a consortium. What we did is, as part of this consortium, we constituted a governance council. Right? Now, this governance council has all the consortium partners, who are the professional ecosystem of 3, 4, 5 entities who are working, plus adolescent representatives from each city, by each of the partners who are interfacing with us. And what we did was, this became a small group of 8-10 adolescents who were representing the larger group of adolescents there. What it did for them was, they really became champions to a level that they started to actually lead these conversations within their neighborhoods for their peers. They started to educate others. They started to conduct workshops. So I think we trained them, and so our target through this particular work that we're doing is to reach out to 1,000 adolescents, right, in both the cities that we're working in. And that means 250 adolescents per local partner. We have 4 local partners. So we basically are engaging at that scale at the moment. But this small core group that we call as governance council, that started to sort of really make a difference, because they started to do conversations with their peers, their communities, to bring ideas. Because we said that your work is to bring ideas, your work is to tell us what you need, how it should be done. Even if a workshop is happening, you tell us how do you want to design it. So it started with little hesitation, because they didn't know about the subject. But once they knew about the subject, the learning curve is amazing. And maybe at some point, adolescents should come and actually talk about their own experience, right? Then this is one part which we are doing with the adolescent ecosystem. The local partners, again, are sort of trained to sort of, in this particular subject, who are also talking to their own ecosystem to advance this conversation at different forums. They are representing this subject in different forums, in different shapes and forms, and talking about it to those who matter, within their city ecosystem, including ground elected members, etc., who are actually helping them to maneuver this work. The third part we are trying to do is sort of with the authorities. We are saying that, we will be developing some SOPs, standard operating procedures, which they will latch within their own policy. we're not saying that we will have to amend the policy, but right now the intent is that, can that policy, point them to a resource like this, right, which can help them generate this data-led development work, and these kind of SOPs then tell whoever wants to pick it up can pick it up. They can tell them that they can go about it. So it is like a step-by-step guide of how to engage communities, how to engage adolescents, what is the kind of work that adolescents can contribute to. And all of this is right now in conversations with different stakeholders for making sure that it exists, sustains at different scales, because it has to be looked at together, right? For a city, it is a comprehensive input, but end of the day it has to house with the providers, and public sector is the provider. So we are trying that if we can bring this this whole understanding of framework and data-led development and inclusion of adolescents, in what way, we also have to tell stakeholders that this is the way they can actually contribute. You can't expect the moon from them, but this is something that they can really do for you. And keeping in view that, this is all done in context of they should not be compromising their education. They should not be. So we work with their schedules. If they're available, we'll work, and that is the kind of flexibility we've built into this work. So we are also putting out these important pointers where if, and also exploring if public sector entities can have some formal ecosystem to, let's say, do an internship program, do a fellowship program for this age bracket, who can come and really contribute. And we are not saying that you bring in a children like 10-year-old, which becomes, because the mindset is very different. But yes, those 15 plus, 16 plus, 17, 18, 19 years, those are the kids that the public sector can actually really use them and use their time as a valuable sort of input, because that's where the core, ground level need really comes up, and authorities can then accordingly prioritize their work. So we are doing all of these pieces. They're yet to mature, and we'll see the growth of it with time. But yeah, all of this is something that we are trying to do.
Very interesting. Finally, I would like to look at, we have understood how we tackle the public sector and the way they can provision the space safe and engage with the young people and the adolescents. The way adolescents also engage with the city, in my view, is out of fear, right? So there is this whole set of adult population which occupies the city in more numbers in some way, right? And I've seen, even if a kid is going around on a bicycle and makes a mistake, the adult quickly scolds them because they are scoldable, right? Don't do this. This is why they didn't want the adults in the room, because they don't make them sit there. They'll always moral police us, right? We have a physical space, but they tower over us with their attitudes and tell us what to do, what not to do. As long as you're not doing any harm, even if the mistake was of the adult, they find it easy to just blame the kid. And that always puts them in a fear of engaging in public spaces. I'm always, even if I do a simple mistake here or there, I get shouted down upon, things like that. How much of a role do the adults in the city play in enabling these young people to actually experience the city without being victimized? There are different types of victimization. One of the simplest thing is scolding. The other thing, get into moral policing. There could also be atrocities, which comes back into safety and gender and other things. The adults have a huge role to play. Just putting on your thinking hat, well, that could be outside the scope. How could you imagine a program that can look at that piece?
To my mind, adults play a significant role. Like I said, that, you can't isolate the caregivers from this age bracket. One thing is that we have to capacitate them. That's a very clear ask. You make them understand why this is essential, and you make them understand with a perspective that how this matters to their own children, right? Because that's when they connect most. And find champions within the communities, who are like, for example, when we are working with communities, we came across a lot of elders who actually really liked our idea of working, and they said that we will support you. If somebody is in the community is not really supportive, we will come with you to convince them. That is the kind of champions we will need from the community. I'm not saying that this is easy, and I'm not saying that this can be done in a day. It's a behavior change that we are looking at, right? And behavior change is a long-term game. It's a long game. It's not something that will happen tomorrow. But if there is a start from one community, one neighborhood, I think that has a lot of merit, lot of potential to get replicated. And if you instill this understanding within this age bracket, tomorrow they are also going to become adults. That's the education they will pass on. So I think that is a very clear model of behavior change that will come. And also, like, understand behavior change in its might. For a work like this, like if it is spanning for 2 3 4 years, then what is it that we can achieve? Correct. And then maybe conclude at a point that these are some areas or future intervention areas that can actually help build that behavior. Another thing is what we've realized is that long-term campaigns can really help. In the sense that information campaigns, we're not saying that, I mean, the information in context of what relates to them, right? How they can sort of understand this aspect in their own context. So you have to contextualize it for them, and then sort of impart that information, knowledge, understanding. And we have to do it periodically. We have to make sure that it becomes it for behavior change to really set in. It has to sort of start at, well, best is to start early, but if not, then this is something that we can inform them, show them, demonstrate to them. Proof of concept will come in handy. Give them examples at how this is happening. What did this do for adolescents who were really part of this, right? And those are the ground stories that can actually help to bring that whole behavior change conversation. And also sort of when we were talking to these adolescents who were largely 17 18 years old, couple of adolescents asked us that why is these kind of initiatives not a regular in our cities? To be honest, at that point we had no answer. We were like, we also know that much. The knowledge that you have is what we have. We don't know beyond that. And what they also came back after a while, spending 1.5 years working with us on the subject, they said that this kind of initiative can actually help guide children from our communities to actually take this up as a career opportunity.
Oh, that's nice.
Now that is the value that you need to tell those, those parents, those caregivers. You tell them that this is what they see it as. That's the kind of livelihood opportunity that will come across if you really invest in this. These are the things that will actually help change the behavior towards this.
There's so much selfishness around that the empathy for many sections do not exist. We are always putting ourselves above any other section, whether it is disabled or gender or youth or young people or adolescents. In our public spaces, there's a one-upmanship where the strongest is always putting their self about others. So a behavior change campaign which brings in empathy for different sections is an amazing thing. I think we should do it across the board for many different things. Is that put you first rather than me first? Because every time you put me first, you're trotting over so many other things that it makes it difficult for us to empower anybody else. The second positive thing I see is maybe these kids, when they grow up, having been engaged in all these things, may not make the same mistake that the current adults are making. Maybe they build empathy that, look, I was told all these things and this is how we need to look. And when these kids are around, I shouldn't make the same mistakes. For the future, this is a beautiful opportunity to, by them engaging, becoming active citizens, and some of them making a career out of this, maybe the next generation might be better off we still have to tackle the short term of current adults making these people worse off.
Like we did discuss that, public spaces usually is not that, up in the list of priorities within our cities. But this is the people aspect is what we discussed today, right? But there is a climate aspect to it as well. And if you do good public spaces, a network of public spaces within the cities, and you bring people perspective, you bring the ground contextual realities to that development, it is going to cater to the climate crisis that we today are talking about. It is going to be a very big contribution when it comes to curtailing the impact of climate crisis that we are facing in our urban areas.
It's very useful that we are tackling two birds with one stone here, is that while we create this empowerment among the young people, we can also get the benefits of the climate. Prerna, thank you very much for coming on the show and helping me unpack this. This was eye-opening because I never looked at it this way. And I don't know how many other people haven't thought through all these things. And it's a good opportunity that you came and told everything. Thanks a bunch.
Thank you so much, Sathya. Thank you for having me.